Welcome. Today, I will introduce you to the project titled Improving Patient Safety Through an Enhanced Understanding of Current Practices of ARO Screening in Healthcare Facilities. I am Jenine Leal, Research Scientist for Infection Prevention and Control at Alberta Health Services and an Assistant Professor at the University of Calgary in Canada. Increasing antibiotic resistance is a global problem. Antimicrobial resistance contributes to significant mortality across the globe. New resistance mechanisms continue to emerge, threatening the ability of acute care hospitals to guarantee patient safety. Lengthier hospital stays, longer courses of treatment, and other expenses attributable to antimicrobial resistance is estimated to cost the U.S. more than $4.6 billion annually. By detecting individuals colonized with AROs through hospital admission screening, enhanced precautions can be implemented to interrupt transmission. With the implementation of electronic medical record systems across Canada and the inclusion of an electronic ARO screening tool as a clinical decision support tool, there is opportunity to conduct a population-based evaluation of the ARO screening protocol and to identify gaps in practices across different acute care facilities. Although routine screening may seem straightforward from an IPC perspective, it may be considered a complex intervention given the need to embed it into the everyday work of healthcare providers. Therefore, it is important to understand individual and group factors which may influence the implementation and ultimately the effectiveness of ARO admission screening tools in EMRs. The goal of this work is to improve patient safety by reducing the transmission of AROs in acute care facilities through the efficient and accurate identification of patients with AROs. To achieve this, our project is broken down into 3 objectives. Objective 1 is to evaluate retrospectively the implementation of the electronic ARO screening tool in EMRs. We will conduct a quantitative retrospective cohort study and an ecological study using secondary data sources to evaluate the adherence, accuracy, and effectiveness of the ARO screening tool in EMRs from approximately 50 hospitals in Alberta and Ontario, Canada. Data from Objective 1 will inform Objective 2, which is to identify barriers and enablers to the implementation of the electronic ARO screening tool. We will conduct qualitative focus groups with clinical staff to understand the determinants influencing the implementation of the ARO screening tool mapped to the Theoretical Domains Framework, or TDF. A matrix that links each TDF domain to potential behavior change techniques will be generated using the behavior change wheel. Finally, our third objective will be to prioritize the behavior change interventions identified in Objective 2 to improve the implementation of the ARO screening tool. We will do this by hosting a virtual consensus meeting with key participants. A nominal group technique by an expert facilitator will be used at the meeting to assess and prioritize context-specific interventions. This research aligns with SHEA's high priority topic of evaluating approaches for the dissemination and implementation of healthcare-associated infection prevention methods. It will provide the necessary evidence to optimize the use of the existing electronic ARO screening tools in EMRs and to ensure implementation of future screening tools, consider and mitigate gaps in process so that ARO transmission can be minimized in hospitals. We will build an evidence base on the adherence and effectiveness of the electronic ARO screening tool using a quantitative population-based evaluation. With qualitative inquiry underpinned by behavioral change theories and frameworks, we will identify gaps in the application of evidence-based practices that are context-specific across different hospitals that use similar EMRs. We will contribute to the scientific literature on the use of behavior change theories in infection prevention and control, particularly on ARO screening. The team assembled to meet the objectives will strengthen interdisciplinary research capacity in IP&C and will facilitate behavior change to ensure application of best practices in the prevention of ARO transmission in hospitals. I'd like to thank our project leads and all the infection control professionals at Alberta Health Services that have supported this work to date. Thank you.